Welcome to Bona Fide HPP, a podcast designed to educate and support the patients and caregivers of those affected by hypophosphatasia. As a mother and caregiver, host Deborah Fowler has discussions about this rare genetic bone disease with people from around the world. Join Deborah now as she speaks with this week's guest.
All right, terrific. Physical therapy is such an important topic and one that's in high demand with HPP patients. Today, I'm joined by pediatric physical therapist, Dr. Donna Griffin of Shriners Hospital for Children in St. Louis. Thanks for being here, Donna.
Oh, I'm so excited to talk with you.
Oh, me too. First question, I just want to take a step back because, I've known you for years. How did you ever become interested in hypophosphatasia?
So I've been a therapist at Shriners Hospital for Children for a very long time, working with pediatric patients, and we're basically an orthopedic hospital. So, but right adjacent to our department was our metabolic research unit. And so for years, I was evaluating and treating patients with hypophosphatasia. I had no idea how rare. I knew it was a rare disease, but it wasn't rare for me because we had our research unit and patients were coming in weekly to be seen for therapy. We would work on evaluations, but also work on strengthening and different strategies with the kids who had maybe some developmental delays. And so for years, I practiced as a physical therapist with those patients. And one of the things I noticed was it really was difficult to get those kiddos stronger. And in 2013, Dr. White in the metabolic research unit approached us to help with some clinical trial work. And just slowly, I kept adding in different little opportunities and to learn more about hypophosphatasia. And we ended up being a part of some of the clinical trial work that went on for aspartame alpha. I was approached as a therapist to help come up with a protocol and some assessment tools that could be used with some of the kids with hypophosphatasia that were in the clinical trial. And we ended up participating in a work group, myself and several other therapists, to develop this outcome tool that was used to help take a look at some of the videos of kids and compare the historical videos to eventually children that were treated. So
that must have been amazing.
Oh, sorry. Go ahead.
I was going to say that must have been so amazing to watch because you had the opportunity to really see how the drug was making a difference in children that you would be seeing, coming back to the clinical trial, time after time. So you probably could really see it firsthand how it may have been impacting that particular child.
Yes, and it was interesting to take a look back at Gates pre and post treatment eventually using this particular tool. And then I was asked to participate in a soft bones patient meeting. And I feel like that was such an important time because not only was I was asked to help educate, which were children and adults and families with hypophosphatasia, but I learned so much from them about what it was like to be an adult with hypophosphatasia. That was one part that I hadn't seen in my practice. And from there, I just feel like I really, things just kind of took off. And I feel fortunate to be surrounded by experts and patients and families that are willing to share their story.
Well, we love having you be a part of our community. So thank you for being interested and for your dedication and the contributions you've made to all of the therapeutic expertise. It's really amazing. I think I mentioned to you, we have a patient community online called HPP and Me. And that's where we had posted that we were going to have this podcast and we had a couple questions that came in. So I'm going to ask you some of the questions directly from the patients that we received. The first one is, I think a lot of people are used to having PT typically after a specific injury or focusing on a particular area of the body. But, I think there's a mindset shift that happens because with HPP, it really is more of a way of life and a way that is an ongoing treatment rather than only when you have an injury. So, I think that, when you think that way and you kind of have that mindset shift, how should we be thinking about PT as a standard way of managing hypophosphatasia and the symptoms associated with it?
Well, that's a good question. Physical therapy, I feel like, is a very important part of the multidisciplinary healthcare team. So I know just from my own practice and listening to patients and families that you have multi specialists when you have HPP. And I think your physical therapist is one that can really help you figure out what your starting point is, help you come up with some strategies to overcome issues like bone pain, weakness, endurance, some of the main issues that patients and families are having. And in the smaller children, just making sure that from a developmental standpoint that they're advancing. So therapists are good at providing exercises and recommendations that can assist with being more functional.
Mm-hmm. Yeah, and I think that's so important for parents to know that, this PT really is not something that is associated necessarily with a particular surgery, but it is something that when your child is complaining about something, really think about physical therapy as part of that team. And we try to, when we're talking to patients about creating that multidisciplinary team, always making sure that PT is a part of it. And I think a lot of the questions we get are, not everybody has access to you. Not everybody has a PT specialist who knows about HPP. So it's that ongoing conversation, and many times patients educating their own physical therapists around HPP. And I think one of those areas of education that I think people could really benefit from hearing from you about is, how do you know, sometimes when you're doing PT, there can be some things where you're pushing yourself, maybe it's a range of motion, or maybe it's a stretch and maybe you're stiff. But, there's that good hurt and then there's the bad hurt. And how do you know which is which? And how do you really keep in mind that, you wouldn't want to do any damage, obviously, if you have something like hypophosphatasia?
Sure. Well, I think in talking with patients, and especially the adults, I think the adults tend to probably have a more of a daily acceptable level of pain that they associate with their diagnosis. That may be bone pain, it could be arthritis, that are related to the diagnosis. And so as a person, your daily acceptable level. If that changes for some reason, and you have a bad hurt that may be a sudden pain, and you can't, all of a sudden you can't weight bear on your foot, then you need to kind of know that bad hurt, that's a sudden pain, could indicate a fracture or some other issue. If it's an achy pain that you have that seems to be associated with prolonged sitting or a particular activity that you're doing, then, it's important to think about where that could be coming from. If you change position and you change your activity, if you sit at a desk every day and you have hip pain and you get up and walk around and that seems to make things better, that may be indicative of some sort of impingement. And so in that instance, you can adjust your chair, your bike, your car seat if you're on a long ride, or you can choose to get up and move around to alleviate hip pain. And that pain's not as worrisome. Mm-hmm. I think most of the time when patients or families, children even, are thinking of a good hurt, if you're somebody who likes to work out and you can tell that you worked out the day before because your muscles are a little sore, but it's something that goes away within a day or so, that's probably what I would consider a good hurt. It's a little bit of a soreness from a normal workout, but it goes away. Yeah. So if you ever have a bad hurt that doesn't go away, you really do need to look into it. And I think you need to have an idea a lot of times of what your resting motion is like. So it seems in adults, sometimes you have a limited hip range of motion, and that's kind of one of the things that goes along with HPP. And so it's important, if you're going to therapy, to try to improve that, that you really know what your starting range of motion is and what your bone health is, meaning, are you fragile? Do you have a good bone health? And also, you just need to have an idea of whether a therapist is getting a softer and end feel. When you stretch a muscle, a soft end feel is, if you're stretching, you feel it give a little bit. But if you get a hard end feel, like a bone on bone bump where things really aren't moving, then maybe you shouldn't be stretching. And so I think that's important at that point to bring in your, if you have an orthopedic physician that's been looking into your bone pain, or you have a metabolic physician that takes a look at your bone density, to bring them into that situation and make sure that we have all the information, because not all therapists are going to understand HPP. So I think it's important to be an advocate for yourself and realize that if it doesn't feel right, you may need to check into it a little bit further.
Yeah.
Yeah.
I think that's good advice. I think it's speaking up and having that ongoing dialogue and not being passive in your treatment. I think really having that discussion point, because therapists are probably looking for that kind of feedback, right?
Oh, sure. And sometimes patients may have, whether it be children or adults, your posture and the position, especially your foot position, can affect and or cause you to have discomfort in your feet, or it can put you in a position where you're more likely to fracture. So sometimes when you have a pain, especially if it's your feet, it may mean that you need to consider some sort of orthotic or some sort of assistive device or something that helps lessen your pain. So again, in the adult population who may be untreated, maybe a brace or maybe an orthotic or maybe even an assistive device like a cane or a crutch temporarily will help you get through a pain that seems like a bad pain.
That actually leads perfectly into another question. And that was, what are the benefits of orthotics? You mentioned some about, stabilization, but, we hear a lot of patients who talk about SMOs, AFOs, orthotics, and their role in correcting HPP. And I think there's some questions about the role of these corrective devices. Are they meant to correct potential deformities or prevent deformities? And in some cases, there may already be some deformities that have occurred. Can AFOs help with some of those? So I just wanted to open up the conversation around orthotics and really what are they used for and how do they help?
So I think orthotics get confusing too, because we have all these little, an SMO and an AFO. I often have people come in and call it a UFO. And so that, just even the naming of that can be confusing.
Yeah. And that with hypophosphatasia, it's like, gosh, you've been learning all different kinds of words here.
That's right. But, orthotics are really, they're best used for a flexible deformity, I would say. In that instance, they're providing support. So if you have a person who's very pronated, which means they have a flattened arch, you can see a tilt when you stand behind them in their calcaneus or their heel. Sometimes an orthotic in that instance, if their foot is flexible, can be used to support their arch. That helps you set your foot up for a better, even weight-bearing surface. When you're in pronation, it puts a lot of pressure, not only on the medial part of your arch that's on the ground, but it also puts some stress on those metatarsals, which tends to be a fracture site in adults. So sometimes a brace can be used to be supportive. And then other times, if you have very limited motion and you may have arthritis, if that motion that you're experiencing, and in that instance, you may have a very fixed range of motion, but you have just a little play there that makes it painful for you. Sometimes a brace can be used to immobilize and alleviate pain. And so if you have ankle pain because you don't have much motion, sometimes a brace can help get rid of some of that pain that is a bone on bone probably situation that's causing discomfort. And so I think the most important thing to realize is they're used for support. They're used to prevent deformities in the fact that if you let that flat foot sit on the ground, muscles start getting tight around there. So it can help prevent future deformity. But I don't know that it's really going to ever help reverse a deformity. If you have a flexible foot, can you put one in your shoe later in life and it will help you? Yes. But if you have developed a fixed deformity, a brace or an orthotic is only going to hold you where your body allows you to go. So it can't change your range of motion, if that makes sense.
Yeah, that makes sense. It's interesting because I know, even dealing with my own son, those orthotics, you show him them and he wants to run the other way. He's like, oh no, mom, that's going to make my cool Nike sneakers, look all
Yes.
stretched out. And, I think that as parents with children, that can be hard to get them to get into a habit of wearing them. Do you have any tips
I
on
agree.
that?
Yes. A lot of times, well, for small children, sometimes it's helpful with balance too, but you want to use your orthotics when you're number one weight bearing, because that's when it's going to help you. It's not going to help when you're, as much when you're sitting down, except to hold a position, but when you're being most active. So if you have pain or instability that's affecting your balance or your endurance when you're moving and you're functional and you're trying to participate in activities, that's probably the most important time that you would want to wear them, because it's helping you get to do something that you want to do.
Yes.
It's helping keep you from being in pain while you do it, hopefully. And it may allow you to walk farther, get from point A to point B with a little less discomfort. And so, there are times where you probably need to take that brace off and let your feet be free.
Mm-hmm.
And so I think if you can kind of, cut a deal with yourself as an adult, or talk to your child about how maybe this is really important when you go run out and play, when you're out running and playing in the grass with your friends, but when you come inside, we're going to take them off for a while, is probably the best way to approach that.
Yeah, that was one of the things when he got his latest set of orthotics. The person who fitted him gave us some very good direction about easing into it. Wear it go for a walk for an hour, for the first day, and then give it a break and kind of break into it, almost like you would a new pair of shoes. And when he did that, now he's realizing that I said to him, are your ankles still bothering you? He said no. And I said, well, see, this is what happens when you wear your orthotics. So I think once a child, especially a child who's experiencing some discomfort from the issue that is causing them to need the orthotic, can really have an appreciation for it once they kind of get past that wearing in period.
Yeah, I think that definitely, because they've learned that it helps me play harder. It helps me be more comfortable.
Exactly.
And sometimes you can find supportive inserts to put inside your shoe that are not as visible. It really depends on what the issue is that is being addressed. But, cowboy boots, higher ankled tennis shoes, and boots are a little more supportive. And sometimes that can help you get through some of those times where you're not going to wear a brace that can be seen, and help manage that being a more reasonable situation for your child or teen.
Yeah. Okay, I'm going to move on to the next question. And some people, we have some very active members of our community who are very into staying in shape, exercise. We have some runners, and there's a lot of questions we get just around staying physically fit, including weight-bearing exercises. And there's a lot of questions around, should people with hypophosphatasia be doing weight-bearing exercises, lifting weights to help strengthen their bones, and whether or not that advice would change if you're on or off therapy.
And so I think an answer to that, whether you're on or off therapy, I think in that instance, you're just considering, again, your bone health. So it's always good to be active. It stimulates strong bone. And so that's definitely important. And you have to be careful, though, that this is an individualized question and answer. So, it depends on your bone health. It depends on your strength. And you want to talk to your multidisciplinary team of healthcare providers, whether it be your orthopedic doctor, your therapist, to make sure that you're participating in the right activities. So, for instance, going for a walk is good. And when it comes to stimulating bone, walking and activities such as running are good, but it may not be good for you if you have some issues with fragility in the bones in your feet. So I think finding safe exercises is where a therapist can be helpful to you. so that you are picking things that are doable. So for instance, yoga and Pilates are very sometimes stretch oriented, but Tai Chi is very slow moving activity where you're not having to do any high impact, but you can be strengthening and still getting some, activities that are going to work on strengthening. If you're trying to work on weight bearing and running is what you like to do, then as long as it's safe, from a bone health standpoint, and you're using orthotics to help make sure your feet are in a great position and supportive running shoes that are built with a little more stability in the arch, and you're not painful, then you're kind of judging that based on your symptoms and what you know about yourself. Right. Sometimes swimming ends up being the best activity if you're somebody who's extremely fragile or your status post a fracture, because that's going to help strengthen the muscles and give you support around those bones that are healing. And so it really just kind of depends on what stage you're in, and you specifically, as a person with HPP.
Okay, great. Another question that came in, again, more of a specific question to a particular patient, but I think that the message around communication with your physical therapist is an important one, especially with some of the maybe not as common aspects that you see in HPP, like calcium in a particular joint or calcium buildup in a particular part of the muscle. And this person in particular talked about calcium crystal deposits in the lumbar spine. How do you recommend that patients have these conversations with their physical therapists, and when should they get the doctor involved?
So I think just creating an awareness of these specific issues that are associated with HPP are really important, because not all therapists that you see are necessarily going to be a specialist in HPP. So they are obviously trained in range of motion, strengthening, endurance, gait, all those things. But you're as a patient, you're probably going to be most aware of the current research on your diagnosis, because that's something that you follow with all your physician visits and such. And so, there's different ways you can go about making sure that your therapist is informed. So you can provide them resources and be an advocate as you talk about your symptoms, but you can also, officially sign a consent form to have some of your records sent to your therapist, so they get the most current, and updated information, and they're in the loop of your care that's being provided by specialists, if they're not from a specialty center. And you can also share, you can choose to unofficially share x-rays and findings from a report, or again, you can sign consent forms that keep them officially in that loop, depending on what your relationship is.
Yeah, I also think, I know that you're going to be doing an upcoming echo session on physical therapy. And I think that that's also an excellent resource for patients who are listening to potentially point their physical therapist in the direction of, so they can become more educated. It's a resource specific to HPP that they can watch and really start to understand what some of the concerns may be when treating an HPP patient.
Well, and there are certain tests, special tests that are used and have been used in the research of patients that have HPP that are also used in just regular physical therapy, things like a 6-minute walk test that might tell you a little bit about endurance. And that's something that a therapist can use to watch over time, get a baseline on how you're doing, and see if you are improving, or maybe you're in the middle of a decline that's associated with something else that has to do with your care or treatment. So I think it's important, to provide the therapist some resources. And I feel like the Softbone site can be that resource, or like you said, the teleecho. Mm-hmm. We also created a therapy sheet. And I know there's research also that kind of looks at the different types of special testing that a therapist could use if you're an infant and a child versus an adult. And so I think as much as we can educate them on some of those special tests, then they can best share their information that they're getting from their evaluation with your doctor. And then they're working in, collaboration with each other to make the best you, yes, and make sure that you're doing the best that you can in functioning every day. So.
Right. The last question, if I had a a dime for every time I heard this question asked over the years, I'd be a rich woman. But we hear from so many parents, especially parents of, children that are just diagnosed, who are concerned about letting kids be kids, letting them go on, learn to ride a bike or go on a jungle gym, or, now it's skateboarding, or, my friend asked my child to go skiing. I think that it's really hard as parents, because, we never want to tell our kids they can't do something, right? But, we also are concerned because of HPP and the spectrum of severity, some kids are very fragile or maybe very prone to fracture. And, when do we say, no, and how do we know where that line is? Do you have any advice on that front?
I think that's a hard one to answer, but I think the answer is going to be different for each individual person. And again, it's going to be based on their bone health, their strength, their endurance, their balance, because if you have any one of those factors that is a primary problem for you, it may affect your participation in that activity. So it's a good discussion to have with your physician. It's a good discussion to have with your therapist, and then try to come up with strategies of, this is my goal. I want to get stronger so I can go do this activity that I want. And I'm fearful right now that maybe my balance is a problem. And that may lead to some other strategies that you can come up with, like maybe an orthotic helps you be in a better position so that you can kind of be proactive and prevent something that could potentially be an injury. But I think, there are certain activities in this world that all orthopedic surgeons love. And those are some of those things that you've mentioned, like skateboards, jungle gyms, trampolines, all those things.
Trampolines, yes,
right.
Yes.
I think you just have to do it in moderation. And if it's something that you're really concerned about, then you for sure check on your bone density, because I feel like that's going to be one of the biggest problems, is but you could fracture yourself riding a skateboard or playing on a jungle gym, no matter what. It's just if your bone is a little more fragile, it's more likely that you're going to have a fracture than somebody who's, maybe a little stronger. So that's a tough one. I don't think there's a good answer necessarily that fits everyone. It's going to be an individualized discussion and a challenge for all parents always, probably.
Yeah. And it's not one that you necessarily can go to your doctor to ask, right? Because so much of it is a judgment call, how much the child wants to do it, the bone health, to your point, their strength, all of those things kind of come into play. And you look at the risk reward when it comes to some of those things. I know that, as a mom of a son with HPP, I struggled with this quite a bit. And it was always the, overprotective mom, who was making sure that he wasn't doing anything dangerous. But then after a while, I realized, he's got to learn some of this on his own. And, I think also just having conversations with him as he got older about some of the risks and letting him have a little bit of part in the decision was kind of a key learning for me.
Yes, and I think that's good as well. I had a thought here. As you were speaking, I was thinking about the fact that it's kind of like our conversation earlier on bracing. I think you need to kind of gradually work yourself into those activities if you're concerned about it, but your child wants to participate, that you start slow. Whether that be something like horseback riding or, like you're saying, skateboarding, that they start slow and don't get into that extreme, sport activity too quickly, but just see how it goes, right, and make sure that it's working for you. And I think letting your adolescent start helping make some of those decisions is a really good answer that you just came up with, because, there's a cause and effect. And I've watched a young man who once treated was able to go on to be the lacrosse goalie. So, should you really tell anybody they can't do anything?
Exactly.
A child and an adolescent will always prove you wrong. You should never say never.
Yep.
But
Yep.
you just have to keep that safety factor in mind, I think.
Yeah, agree. Well, Dr. Griffin, thank you so much for sharing your incredible knowledge with us today. And we look forward to continuing the discussion in the future.
Thank you so much. It was great talking with you. And I look forward to meeting more patients and families, because I feel like I definitely learn from everybody each time I do. So.
Absolutely. Well, you've been listening to Bonafide HPP, a podcast of Soft Bones, the U.S. Hypophosphatasia Foundation.
Join Deborah and other patients on HPP and Me, where they continue discussing questions around hypophosphatasia and submit questions for the next podcast. Go to softbones.org and click on Community, then HPP and Me for instructions on how to sign up. This podcast and the intro music was produced and edited by me, Patrick Jaguar.